Hi, my name is Dr. Talal Khan, and I'm the founder of Khan Longevity Care, which brings healthcare 3.0. And today I'm here to talk about longevity medicines. There's a lot of buzz about longevity medicines, and there are certain medicines now that we have in our toolkit that we can use to make people live longer with what we call health span. I'm going to start my discussion of longevity medicines by first talking about GLP-1 receptor agonists. And these are semaglutide, Ozempic, Mounjaro. They are more than just weight loss medicines. They are actually now being used for longevity. Some people doing microdosing, which is using small dosages of these medicines to help optimize blood sugar levels, prevent blood sugar spikes, help manage insulin resistance. These medicines have traditionally been available in sub-Q form, but now are going to be available to be taken by mouth. This will increase the range of people that can actually take these medicines, and traditionally these medicines were very expensive, where these medicines are now going to be affordable for Medicare recipients and other patients at a much cheaper price. Next up in longevity is metformin. Metformin again helps with blood sugar management and decreases insulin resistance. Something to watch out on while you're on metformin is your ability to form muscle if you are working in the gym and looking for those muscle gains. Another class of medicines that are now being used for longevity is the SGLT2 inhibitors, which are being used for cardiometabolic protection. These are basically diabetic medicines but show promise in longevity field because they reduce glucose burden, decrease inflammatory stress, and support metabolic flexibility. And so they promote cardiovascular health and they enhance longevity. No discussion of longevity medicines would be complete without statins, but they are extremely powerful in reducing LDL levels, especially when LDL becomes oxidized, forms something called foam cell, which are the beginning signs of forming plaque in your arteries. I'm very excited about the oral PCSK9 medicines, which they would lower LDL even further beyond statins for those patients that are at risk for coronary artery disease. Next up is hormone optimization, which for men is testosterone, and for women estrogen, progesterone, and in some cases testosterone management. FDA has finally, after years, taken the black box warning down for hormone replacement because it can be life-saving or life-changing. The key with hormone optimization is responsible prescribing. It is extremely important that you are being taken care of by somebody who understands hormone management. When used appropriately, it can help muscle, bone, metabolism, sleep, and mental sharpness, and improve quality of life and what I call functional aging. Next up is peptides in longevity medicine. The peptide field is a buzz. We obviously need more data, but there are certain peptides that have shown promise, especially C157 has shown a lot of promise, along with thymosin alpha-1, CJC1295, GnRH hormone, which actually acts on the pituitary to produce growth hormone. Next up is rapamycin, which has gotten a buzz with its work on the mTOR pathway. And rapamycin definitely needs more data, but it is again a promising longevity medicine because it enhances autophagy, which is programmed cell death for toxic cells, and decreases inflammation. What's extremely exciting is that there is a class of drugs now for dementia and treatment of Alzheimer's dementia. Think of these medicines as amyloid, which is the protein or plaque in the brain that can be disrupted by these new monoclonal antibodies. So in our longevity pathways, we would try to do mental examinations and identify cognitive deficits early, and then follow that up with MRI and PET-CT. Recently, there has been blood work that has been approved that we can measure amyloid levels of a specific protein in your blood, and we employ that as a part of our longevity metabolic optimization panel. This is a debilitating disease. And finally, we have something that we could go after and help people increase their health span, the non-negotiable foundation of longevity, and that is lifestyle. Lifestyle is the best medicine. And here in Khan Longevity Care, we work with you so that you can build the lifestyle that would increase health span. In general, it involves strength training, VO2 max assessment, identifying and measuring body composition, muscle to fat ratio, and increasing muscle to fat ratio, which means more muscle and less fat, eating nutrient dense food, measuring sleep through variables like Aura or Whoop, and treating and preventing sleep disorders, stress management, emotional health, and developing purpose and social connection. These are all fundamental lifestyle changes which, when paired with medications, can be extremely important for longevity. So what is the future of healthy aging? Longevity now is a data-driven discipline. Metabolic tracking, hormone mapping, advanced imaging, VO2 max testing, cognitive screening, body composition analysis, precision therapeutics. It is proactive, it is preventive, it is personalized. And the goal is to build a system to have people stay biologically younger for longer, which is health span. This is healthcare 3.0. And here at Khan Longevity Care, we are building the foundation of healthcare 3.0. If you are looking to understand your risk for chronic disease, understand your biological age, optimize your metabolism, protect your brain, protect your gut, and build a personalized longevity plan, make a consultation with myself at Khan Longevity Care.